One of the things I hear all the time from my clients is, I know chiropractic treatment is available in workers' compensation, but I've never been to a chiropractor before. All I hear is stories that I don't know what to expect. I'm too scared to go. In this video, I'm gonna peel back the curtain and take you into a real chiropractor's office, interview him, ask him all the questions that you've been wanting to ask, and let you come with me as I have a chiropractic adjustment performed on myself. And then you'll know exactly what to expect at a chiropractic visit. So we're here with Dr. Tony at his Upland facility. Dr. Tony practices at Euclid Chiropractor and at Velez Chiropractor. I will link to their information in my description below. Dr. Tony is a licensed chiropractor that specializes in family practice, scoliosis, child and adolescent care, nutritional counseling, and exercise rehabilitation. Thank you, Dr. Tony, for being with us today.
Welcome. Well, nice to meet you again.
My clients would like to know a little bit more about chiropractor. I do get this question a lot that they're actually kind of scared when they go to a chiropractor. They're afraid something's going to go wrong or they're going to actually be worse.
My question first is, what's your clientele like? What do they see you for?
Most of them are orthopedic injuries. There are some psychological, which I don't think you're counseling them as your
I can tell them jokes.
adjusting.
I can tell them jokes. I thought I can do.
But the vast majority are orthopedic injuries.
So more structural, more soft tissue and or joint and neurological issues too. Good.
That's correct.
Perfect. This is what I do. You're in the right place.
First question is, what physically happens when you make an adjustment, when you crack a back or a neck?
What we do is release pressure. The reason is pressure builds up over time from a joint not moving properly, especially a spinal joint. Your joints are handle vertical load of your body, base gravity times weight of your body mass on top of your spine. When that happens, your joints sometimes will lock up where they can't move. Because of that, it normally wants to unlock on its own, yes. Because of trauma, injury, stress, what will happen is the body will stay locked. Stays locked long enough, now ligaments around that joint start to tighten. That lack of motion builds up pressure. So my job is to make those joints move. We call it cavitation of those joints through the adjustment to make those bones move. That will release pressure. Over time, make the ligaments and joints now stretch. So now your body goes back to its normal ability to handle the pressure on its own by staying loose, having more motion.
Good. One of the questions that's actually the main concern, the one that my clients are like, but what if? The question is, when you're adjusting, what if they get scared or they tense up or they move at the last minute as you're doing the adjustment? What might happen?
What can happen is a doctor should stop and wait. The doctor should be able to read that patient based on experience, based on time being in the field, based on seeing people over a period of hopefully months and years, realize patient's not relaxed yet. We need the patient to relax so we can cause a range of motion, moving the body left and right, for example, the neck. Then once the body relaxes, then adjust the body. The way we adjust is sometimes we get people to relax, we have them breathe. For example, tell them a quick story to get their mind off of it. I have some tricks that I normally do too that I don't want to spend on the camera because I'll share my secrets of how to get them relaxed. Get the first one out of the way. At that point, they go, okay, that's all it is. Good, now I'm safe. My first adjustment is always fun for me. Because I'm entertained. You don't know if they may cry, they may laugh, they may speak in tongues, may have Tourette's. And especially if their family's in the room too, so they may even have a reaction also. So my job is first make it safe. Once it's safe for them, then I get them relaxed. First, at that point, they're going to be good to go.
The next question is, does it actually hurt when you're being adjusted, when you feel that crack?
It usually does not if it's not a severe problem. The problem is sometimes people come in and they have a lot of muscle strain along with the joint pressure. By us adjusting the joints, yes, we have to make the muscles stretch. The muscle stretch is too far. It can make the muscles more sore. So again, it's the doctor's job, the chiropractor's job to make sure what point can I stretch them enough to where it's not going to cause injury. Sometimes they will be sore the next day. Realize what connects the joints together, the spine, are ligaments. Ligaments, when you overstretch them more than they're used to, they can make it sore the next day. So we want to make sure we prepare our patients, let them expect this or expect this based on their symptoms, how they're doing.
The question is, a client comes in or a patient comes in and, as I say, they're pretty messed up. You do their adjustment. They're feeling a lot better. How long can they expect the effects to last?
Because every person is different. It depends on if they have a chronic injury. Chronic injury is now, ligaments and soft tissues have now adjusted that tighter spine when it's built up pressure we talked about before. We have to make those ligaments and muscles basically stretch as we adjust, get the pressure off. Someone's come in where they've been a patient, for example, before. They had a problem yesterday where they lift something wrong. They came in. We adjusted them, they're going to be fine. So the biggest thing is with someone being adjusted, if they're having a lot of symptomatology, a lot of muscle pain, a lot of muscle tightness, they may take longer. If they have neurological problems, they have problems, for example, people come in, they have numbness down their arms, pain down their leg, headaches, a lot of headaches too. Because of those symptoms, we have to take away those problems first and then make the spine looser. And over time, the big goal is to make their body stronger. When they're stronger, then they can stay healthy on their own. So again, we talked about before initially what we do. We give them exercise guidance to make sure that they're doing the right things at home so they can maintain that on their own to keep their body healthy and strong.
What body parts or injuries does a chiropractor able to?
Usually a chiropractor will focus on the spine, which means the back of the neck, base of the skull, down to their tailbone. Some chiropractors will also adjust the hips, adjust the shoulders, adjust the elbows, adjust the wrists, and also adjust the ankles and knees. Every chiropractor is different.
And what body parts or injuries will a chiropractor not touch?
If something is, for example, there's a chance of being fractured or broken or dislocated, a fracture, break, or dislocation we will not treat. We'd want to take an x-ray first to make sure it's not broken, torn, or dislocated, and then we may move a joint for one too. But there's very little joints, especially superficially, that we will not adjust.
And besides adjustments, what other treatment can a chiropractor provide?
Stretch how to strengthen, posture correction, along with balance correction too, and gait correction. A lot of our bodies, when they have an injury, are thrown off for a period of time, so now our bodies learn to maintain that abnormal normal for them. Get them to more of an optimal normal, again, by learning how to get their body to shift and reset their body over time.
For a chiropractor, what kind of training do they have to be licensed? Are they considered doctors?
Yes, we're considered doctors nationally now. There's 3 types of doctors in the U.S. Medical doctors, obviously, osteopaths, DOs, and also chiropractors. We're licensed to see everybody. So we're the first, if you want to call it, port of entry doctors, and our training comes from graduate degrees. And from there, it's about 3.5 years of schooling. I also have to take state boards. It's about 4 of them. You have to pass before you actually get your license. Ethics board too through the state of California.
Are chiropractors able to prescribe medication?
We are not. That's one big thing. Glad about that. I forgot about that question. A lot of it is chiropractors, people are still coming to us for medications. We are, even though we're port of entry doctors, we do not prescribe medications, we do not do surgeries. Anything like anything prescribed with that word is not what we do. Yes, some chiropractors sell vitamins on the side for one too in their office for one. Anything that's city approved, we're not to do, not part of our license.
Chiropractors able to certify EDD for disability?
Yes, we are. With disability, we actually, as chiropractors, we have done in the past for our patients, allow them to stay off of work if need be. So we want to make sure there's a reason why, based on their type of work. If they have a desk job and a hurt foot, yes, please go to work. If a job where they're construction all day long, climbing buildings, climbing ladders, I may not have them work.
Excellent. Well, thank you, Dr. Tony. And we'll see you soon for my adjustment.
Hi again, I'm Dr. Tony. This is Naomi. She's going to be my patient today. We're going to explain how the neck and the low back and the mid back adjustments go and how they work. By explaining, our goal here is to make sure you feel comfortable when you come into a chiropractic office what you should expect. I'm going to show you exactly what we're going to adjust here in the neck first, have her lie down in a second. I'm going to adjust these bones here at the base of the skull down to the shoulders here. We're going to adjust there. We're going to move things around left and right over time by doing a quick cavitation left and right, make things want to move better. Okay, you might hear some popping, you may not hear some popping, but the goal is can we cause more motion, ligaments that can stretch to make that motion stay that way. All I'm going to do is I'm going to have Naomi turn her head to the right. By doing that, now it exposes that left side of the neck for me to move these areas. I'm going to use this part of my hand right here to cause that contact with the bones of the spine. Make sure your shoulders are relaxed. She's breathing normally. She's not tensing up on me. At that point, I can get in here, take a deep breath in, all the way out, right here, and move that bone just like that. Okay? We'll turn around to the other side too. Same, make sure she's breathing normally, nice and relaxed. Shoulders relaxed, muscles not being under tension. Hold it right there. Take a deep breath in, all the way out, right there. That allows the bones to move normally. A very quick motion, but a very limited motion, just we're not going to rip the neck off, so the muscles don't want to strain, ligaments just want to be stretched out. Mid-back will contain between here, top of the shoulders, down to about here, okay? This is the lower back portion. The reason we shift them, we change them around, these bones are oriented or shaped differently than these bones. By having these bones shaped differently, we want to adjust obviously differently too. So the goal here is because the rib cage comes around both sides, it can build up a lot of pressure, causing pressure where there's local pressure here, or even pain where someone breathes in to where it causes pain in those ribs. So we can keep this area loose, keep the body up, the posture up, allows not to build up pressure. We release that pressure now and over time, change someone's posture to make their body stay more straight. Whereas a lot of people, what they'll do is actually hunch forward. Okay, so have you do it in your stomach for me, Naomi? What I'll do is my contact for here is going to be more of a push straight in by putting my hands here and here, using this part of my hands to allow my body to stand right over that patient and push straight down. Take a deep breath in, all the way out. Good. Deep breath in, all the way out. Deep breath in, all the way out. Then one more time. All the way out. Good. The next step is getting the lower back to adjust. Also, I include the lower back adjustment as here to here, but also the hips too. What happens is these hips can shift up or down, with causing it to pinch the actual spine and the nerves. We do because these hips here are connected to the legs. We check the leg length itself by coming down here, pulling the legs slightly so they're more even. And over time, as you can see, Naomi's legs a little bit on the left side, a little bit shorter. That means that this hip is higher, this hip is lower. This hip comes higher left and in, causing rotation to the front. The right leg being longer will have rotation to the back. I'm gonna adjust the spine here. My contact points will be, yes, the lower back, but also the SI joint at the same time, because I have big hands. I can do both one time. Okay? Have you do is bring your leg off the table. It allows more of the lower back to stretch and open up for me to get the adjustment started. I'm gonna lean over the person. I'm gonna have Naomi take a deep breath in, all the way out. Shoulders relax right there, and just like that. Okay, that allowed the joint to cavitate. That was what that pop was. Allows areas to move, so now it frees up not only the SI joint, also lower back joints on both sides. Let's switch sides also. Make sure we get those sides. I'm going to contact that same side right across the back. Then now drop that arm down. There we go. Get that pressure off so it makes the hips more even. Okay, let's go on your stomach for me one more time. And now let's see what our results are. More level, right? Is our job is, yes, to adjust the spine, move the bones, relaxes nerve pain down the arm, down the leg, causing headaches to go away too.
I hope you got a lot of value out of this video. If you did, please support our mission of empowering clients everywhere through education on the legal process by liking this video. That way more clients can see if chiropractic treatment is right for them. Thank you. Bye. Of this video. Please like this video so more clients can see this video. That's way too many of these videos.